I'm Dr. Kenneth Levine. Welcome back to Health Talk. Here with Dr. Dick Greene, the dermatologist to the stars, including myself. Dick, if someone has skin cancer, what are the treatments available and how do you make those decisions?
Well, that's a very good question. The most important thing is your clinical evaluation. You know, we've seen so much for many years that very often they're fairly obvious. 3 types of skin cancer: basal cell carcinoma, which is the most common cancer in the world of any sort, never mind skin, then squamous cell, and the worst of all is malignant melanoma, and melanoma is a malignant mole. That's the only one that we think of as life-threatening and important. The most important thing is make the proper diagnosis, and we talked a little bit about having the proper pathology, and it always requires a biopsy. Nobody's going to go and treat something without taking a piece, sending it out to the lab. If I'm nervous, I'll put it on rush so we can get it back very quickly. And we never file a biopsy in somebody's chart. It stays out in untreated, territory, and we will stay after that patient until we get them in and say, this is your biopsy, this is what we have to do. The treatments can be something very simple. In today's world, there are topical things that treat some skin cancers. Right. That would be the easiest. The second thing would be something that I can do, and I can say, what I'm going to do is 5 minutes. If I send you for Mohs surgery, it might be 5 hours, and this is amenable to that type of treatment. So we may do a local, what we call C&D, where we scrape it and burn it, 90% cure rate. But there are those areas, eyelids, nose, etc., that are difficult, and we want Mohs surgery, and we'll fit our type of, treatment to the individual lesion. One step up, I could excise it and ask for margins. There are things that are not appropriate for surgery. The people are not in good shape, they take blood thinners, etc., may be treated radiologically, and there are a lot of good people in the community that we work with, and we can send it to a radiologist. They can treat the tumor locally with radiation. So you really have to fit the location and the nature of the tumor to the treatment.
Give me the Reader's Digest version quickly of what Mohs surgery is.
Mohs surgery, first of all, Fred Mohs was the man who invented it. He was a general surgeon, and he was out of Michigan, and he developed a stage-by-stage process. Think of it as this. If you have a lesion on the cheek, they would take a scoop and picture a pizza, and that is frozen and stained, and it takes about a half hour. And then this doctor, the Mohs surgeon, is also the pathologist in that case. So he looks at his frozen section, and he may say, oh, it's all clear. Or there's a little bit of tumor left between 9 and 12.
All clear means clear margins.
Clear margins.
Okay.
He may say there's still tumor between 9 and 12 because it's all mapped out. Now you're already numb. He'll go back and clean that area. He's not going to stop. I have people that have taken 6 stages of Mohs, start 8 in the morning and finish 4 in the afternoon. But when they're through, they have no more tumor.
Now, okay, I want to switch gears for a moment while we have time, and we'll continue our next segment. Let's talk about the cosmetic things that you do to make people look better without surgery.
Dermatology is a wonderful field because in one room I have a youngster with acne, and they're really upset, and I take it personally. And I don't think anybody should just say you'll outgrow it because you don't want to be left with scars. But in the next room, I may have a melanoma. Well, those are all medical things. But years back, I could see the changes coming in insurance and in government intervention. And I started doing a lot of cosmetics. And now dermatology does things that are, on the verge of plastics. And we do everything from face peels and every type of laser. We can take off brown marks or red marks, etc. My favorite things are Botox, which I never thought I'd do, and now for the last 8-10 years, it's a major part of our business. People love it. Young people don't want to be old. It's a modern world. Just did an article in the Sun Sentinel about how at one time you never saw men for those things, and now 40% of my cosmetics are for men. It's a competitive job market. They want to look young, bring in young people, and it's important. And I got into, in the 60s, late 60s, into hair transplantation. And I've done over 13,000 people from really all over the world, and it's been my pet. And I love what I do, and that's a permanent type of cosmetic procedure, what you give people they have for life. And most people have been very happy.
Is that a one-step procedure, or is it done in
Not
stages?
necessarily. There are a lot of places that say they'll do X number and it's only one time. It's never really one time. For the most part, it's a staged procedure. But I'll tell people right up front, I said, you're going to be happy with what I do for you. But you may come back in 9 months or so in a year and say, I love what you did, but I want more.
Okay. You know what? We're going to talk about wanting more in just a moment, and I'll come back with you. I'm Dr. Kenneth Levine with Health Talk. See you in just a moment. Thank you.